That's it. Good. Okay. So, hello everybody. My name is Steve, and I'm from the Commitment to Carers program. And welcome to another edition of Experience of Care Week. And this afternoon we've got a systems approach to supporting unpaid carers. I'm only going to be chairing the session. We've got our presenter today, who is Campbell, who's our regional lead in the North East and Yorkshire. I'll just run up some quick housekeeping notes just before we start. So the first one is, please feel free to leave cameras on, but you've been placed on mute just to avoid any background noise because we'll be recording the session. And the session will also be shared. The recording and the slides will be shared to those who have registered for this session. This is coming from the people organising the Experience of Care Week, but I think we'll be happy to share some of the recording on our Commitment to Carers workspace on NHS Futures platform. If you're not registered on the platform, I'll put the link in the chat box so you can register and please request to join our workspace, and we'll be able to send you all the recordings and the presenter slides. For this session, please, if you can put any comments or questions in the chat box, and these will be picked up at the end, towards the end of the presenters. And any questions at the end of the session, please can you raise your hand by clicking on the icon. You can see the icon at the top. I'm sure most of you know how to do that by now. And we'll be able to unmute you and you can ask your question. And if you have any other technical issues, also please just drop any of the questions in the chat box. I will be passing on to Campbell now, who will be leading this session. Welcome to you, Campbell. Over to you. You're on mute, Campbell. You're on mute.
I see you practice and you practice. Hello, my name is Campbell and I'm a leadership support manager working on the Commitment to Carers agenda across the North East and Yorkshire region of NHS England. In the next 30 to 40 minutes or so, I'm going to be talking about our system-led approach to taking actions to improve the experience of unpaid carers in our region. My experience in the role has shown me that the only way that we can work to improve the experience of unpaid carers is at a system level. And to me, what that means is that everyone working in the system has a responsibility to support carers, and that we in the system then have a responsibility to listen and then act on the voices of unpaid carers to ensure that what we are doing actually works, and then more important, that it will be sustainable. So the breakdown for the session is as follows. As I say, the purpose of this session is to set out just one of the approaches that we've implemented in the North East and Yorkshire region over the last couple of years to improve the experience of unpaid carers. And what I'm going to be focusing on today is the co-production process that we put in play to develop carers resource packs. Through the session, I'm going to make quite a lot of reference to websites where you can find much more information, and the links are embedded on those slides. So Steve and I just had a chat, and we're going to make all of the slides that I'm going to share today available to you, and all of those links are embedded on the site. Now, obviously, if anybody wants to get in touch with me after the session, I know what I'm like, I can go on. So if we get to the end point and you haven't had a chance to talk to me, I'm really happy if you want to just email me directly. And my email address is widely known, and I can also put that in the chat box. Throughout the session today, I'm going to play 3 videos that actually have all been developed in West Yorkshire Health and Care Partnership that give a flavour of what it's like to be an unpaid carer. I'm also going to have a quick look at definitions. That's always an interesting area in this work. And then I'm going to discuss the drivers. Why is it that we're actually doing this? Why do we need a system-led approach to working with carers? And then I'm going to look at the packs themselves, and I'll talk about the approach that we have taken to develop them. And the purpose of the packs is to make it as easy as possible for anyone working in the system to be better able to identify and then support and then signpost carers. I'm then going to look at the evidence that we've got about how useful the packs are, and then I'll finish with a section, just got a few bullet points about next steps, what we're going to do next. But before I begin, I want to show you this video that gives an idea of what it feels like to be an unpaid carer. The video is actually developed to support an approach for working carers in West Yorkshire, but I think the video gives a really good idea on the feelings of what it feels like, as I say, to be an unpaid carer. I really like that video because it really gives a sense of the pressure and the kind of the unrelentingness of what some unpaid carers experience in their caring role. Quick tangent on technology. My experience over the last few years is it doesn't ever appear to be ever completely right when you show a video through Teams. So I'm really pleased to see that some people can get the audio. What I'll do is, as I say, each of the slides has got a link to where you can find the video, which they're all freely available on YouTube. And if I get a chance, when we do the next one, which is a brilliant one from young carers, I'll see if I can find a link and post it in the chat box so that if anybody doesn't have access, they can either view it as we're showing it live on this session, or they can have a look at it after. Okay, so next thing we're going to go into is this crazy world of carer definitions. This is the general definition, and it's taken from an NHS England website, and it's pretty much one that's on the definition of a carer from the Care Act 2014. It states that a carer is anyone, including children and adults, who look after a family member, partner, or friend who needs help because of their illness, frailty, disability, a mental health problem, or an addiction and cannot cope without their support. The care they give is unpaid. So first of all, for us, the important element of all of these definitions is that the care they give is unpaid. Paid care work, if you like, is out of scope for the work that we are doing. But one of the issues we have in the carers world is the definition in general of an unpaid carer. This is important, and it underlines the fact that only the person who we are having conversation with can define their own caring role. The only person that can define someone's caring status is the carer themselves. The vast majority of people we would like to reach to make them aware of the offer that they have would not identify themselves as a carer. Instead, they are a mother, a father, a daughter, a brother, etc. But the next slide is a more detailed slide that we have developed as part of the development of the Carers Resource Packs that I'm going to talk about later. So I'm not going to read out each of the definitions, but again, the slides have been made available. But of all of the definitions, my favourite one, or the one that really rings true the most to me, is the top one from Carers UK. Carers UK defines a carer as people who provide unpaid care by looking after someone who is older, disabled, or seriously ill. These people are called carers, but they would probably just say that they were looking after someone. The reason that we have this slide in the Carers Resource Packs is that carers who were involved in the development of the packs said in workshops that they had noticed that some people that they have contact with just don't get it. And they were keen, for example, that a parent carer role was defined as being different to an adult carer role. Personally, I think that the definitions discussion will go on. I think the discussion is healthy because anytime we're talking about it, we're talking about unpaid carers, which is really important. But the key message that I've received from carers is please don't make an assumption about someone who you think is a carer and what support they may or may not need. Please talk to people as an individual and then support them from that perspective. Talking about definitions, I think it's really important that we have a really quick look at the census data. And there's a lot of information on the census 2021 data for unpaid carers. And I don't have time in this session to go into too much detail, but should you wish to look, there's a link on the slide that will take you to the ONS, the Office of National Statistics page, where they go into much more detail about the data. Suffice to say that the headlines from this data are that on Census Day 2021, there were approximately 4.7 million unpaid carers in England. And again, I'd like to highlight the issue that this is only a count of the carers who on that day chose to identify themselves as unpaid carers when they completed the survey and answered the question that was in the survey. There are approximately 120,000 young unpaid carers aged between 15 and 17. And that since the last census, there was a higher percentage of people providing unpaid care in the most deprived areas in England, compared with the least deprived areas. Over 250,000 rise in the number of unpaid carers providing 20 to 49 hours of care from the last census data, and 152,000 rise in the numbers of carers providing over 50 hours of care to just over 1.5 million. So I'd just like to say that number again, 50 hours of care. There have been discussions about the drop in the total numbers of carers from the 2011 census. And if you go onto the link on the slide, the ONS have kindly set out some of the reasons behind this, including the issue that the question 2011 census was different to that from the 2021 census. But my takeaway from the numbers is that almost 1 in 8 of the population has chosen to describe themselves as an unpaid carer. And of that 1 in 8, a great deal are providing 20 to 50 plus hours of unpaid care a week. So we know that there's a huge amount of carers in the country, but why should we do anything to support them? So this slide just sets out some of the reasons. It's actually evidence from the 2021 GP patient survey on the impact of caring. And in this survey, carers were more likely to report mental health conditions. Carers were more likely to report arthritis and ongoing problems with back and joint pain, more likely to have breathing conditions. We have this evidence, but I'd also recommend if you look up your local carers organisations, that you'll be able to get a picture, a local picture of what carers' experience are like. I live in Leeds in West Yorkshire, and just the other day I got an email from Carers Leeds, the voluntary sector organisation in my city, with the results of their local survey. So I would really encourage you to have a look at those surveys. They give a really good picture at a local level of what the current experience is like for unpaid carers. So, in addition to this moral argument as to why we should have a system-led approach to improving the experience of unpaid carers, there's also a growing body of policy and guidance on actions that should be taken. This slide highlights the ambitions for carers in addition to the asks from the NHS's long-term plan. The recent Hewitt review, for example, has got a call for ICSs to better involve, integrated care systems to better involve and engage carers, as well as a specific mention of carers' passports in the NHS app. There's also guidance for virtual ward teams, urgent community response teams, palliative care teams, and the recent Dynamic Support Register and Care and Education and Treatment Review policy calls for better contingency planning and the involvement of carers in decision making. And again, I won't go through this slide in detail. And again, all of the links to the guidance are included on the slide. But I would like to talk about Section 91 of the Health and Care Act. This section states that carers must be involved in discharge discussions when the person for whom they care is being discharged from hospital. And the reason I mentioned that is to give a plug to a wonderful toolkit that has recently been developed in London that sets out a pathway for teams to follow to ensure that carers are identified and supported through the discharge process. Debs, Roz, I'm not sure if you're on the call, but this plug is aimed at you. Although the guide is developed and aimed at London-based systems, its messages of support and better communication with carers are universal. And as an offer to systems looking to ensure they're compliant with the legislation, it is a must-have. I highly recommend a look at that. And again, the link's on the slide. And now thanks, Debs. And now I'd like to show you another video that again was developed in West Yorkshire, and this time it's highlighting the voice of young carers. And as it's playing, I'll see if I can dig out the link and I'll post it in the chat box for those that don't have access. Powerful stuff. I had the privilege of attending the launch event for that video in Leeds, and it really was quite moving. The other thing I'd like to do, and again, I don't know if there's anybody from West Yorkshire, maybe when we do questions and answers in about 10, 15 minutes, if anybody's from West Yorkshire and wants to talk more about their trauma-informed approach, I just want to give that a plug as well. The work was very much done. The work was led by young carers. Young carers' voice was very much involved. I think you could see that some are on mobile phones, some are actually filmed. It was very much up to them how they wanted to get their story across. And an astounding piece of work, in my opinion. Again, I'd be really happy if anybody wants to be connected in to the team that developed that video. But moving on, now I want to talk about the Carers Resource Packs. And what the Carers Resource Packs do is they, if you like, are one of the ways in which we are responding to the issues that I've spoken about, the need, the moral argument about why we need to do it, but also the policy argument. What the Carers Resource Packs do is they make it really easy, for example, for a virtual wards team to be able to ensure that carers are identified, supported, and then signposted. So it makes it really a kind of really easy way, if you like, for a policy team to be able to capture the carer information in one place. So this now takes me to this slide, and this is my attempt to show the Carers Resource Packs in just 8 icons. So if you imagine the pack is in the middle, and it's designed to be a connector of health systems represented by the blue cross, with voluntary sector, local authority, and other bodies on the right-hand side. And you can also see that the arrow intentionally goes both ways. And the reason for that is that the packs are developed in Teams meetings with a wide range of stakeholders, including carers. And our experience that these meetings in themselves create networks across health, local authority, voluntary sector organisations. And those connections in themselves are useful to promote action for improved services for carers. And a great example of that at the moment is through the Integrated Care Partnership Boards that are happening across integrated care systems. I think the carers agenda is a classic example of how systems can come together to work together, and those can be reflected successfully through integrated care partnership boards. Talking about stakeholders, again, this is the system, if you like, and this is how the system led the development of these packs. And this slide sets out from a kind of wider regional perspective the range of stakeholders being involved in the development of the Carers Resource Packs. So the first one, loud and proud, carers. Any Teams meeting that we have to develop a pack is not CORIT unless we have a carer involved in that. And that's certainly true for the initial meeting where we kick off the work. Carers, it's been really easy to find unpaid carers in the region, largely identified through local authority carer boards themselves. Carers already exist, there's already voices out there, but what we've also tried to do through the work is to get the voices of carers that are not normally represented, and that happens at place. We have had great involvement from health. In South Yorkshire, for example, we have a lead GP for the work, Dr. Sarah Jones, but we've also had involvement with GP practice staff. We have also had involvement with secondary care teams, GUL at the moment, working with in the development of the North Lincolnshire Pack, for example. We've also had involvement through the integrated care boards themselves from a health perspective, and place-based managers. I have got 4 contacts up here in each of the ICBs who have been really supportive in the development of this work. We've also had involvement, for example, with ambulance trusts, and we've had involvement in North Tyneside, which I'm going to talk about in more detail in a second, through the optometry services and through pharmacy services. The packs were initially designed for GP systems, for GP land, but what we're finding is that they're really useful across the system. So it's not just, the packs are no longer just aimed at GP systems. And I would argue this work couldn't happen had it not been for the local authority carers leads with whom the work usually starts at place, all identified through the ADAS networks. We've had wonderful involvement with personalised care team staff, social prescribers, their managers, health coaches, care coordinators. And again, a quick shout out to the Peer Leadership Development Programme. Kirsty Jowett's our lead for that in our region, again providing a wonderful way in which carers can learn the skills it takes to have a conversation in the NHS. Highly recommend the Personalised Care Peer Leadership Development Programme. And what we're trying to do up here is ensure that all the carers that I get involved with, I at least am making them aware of that free training. And again, if anybody would like some more information on that, please put a note in the chat box. Couldn't do this work without, and I'm choosing for the purpose of this slide to call them VCSE organisations. I never get that right. But for the purpose of today, it's those commissioned services providing support to carers. And the other services, for example, off the top of my head, palliative care teams we've got involved, and also the kind of non-commissioned services such as Mobilise and Bridget. A real range of people involved in the work. To develop a carers resource pack, the average, I think, the number of stakeholders we have at place is roughly between 15 and 20 different individuals that come together and feed into development of the work. The purpose of the pack is very much to make it much easier for the system, and when I say the system, I mean, as I say, initially GPs, but it could be anyone, to better identify, signpost, and then support an unpaid carer. The audience of the packs are not carers, and that's really important. There's already a great deal of information out there for carers. The audience of the packs are people working in the system. It started with GP teams, but we've found that the information in the packs is useful across the board. So, for example, in pharmacies, district nurses, discharge teams in secondary care. The pack set out how teams can better identify carers, so that guidance on ways such as never asking the question, are you an unpaid carer, but instead putting it in such a way that's more likely to get response, such as do you provide support to someone that could not cope without your support. We then look at signposting, guidance on the range of local services, guidance on self-referral and referral routes, and we also look at support. What are the benefits to a service on supporting carers? I've mentioned the moral and the policy arguments, and the pack goes into a lot of detail about the practical elements of that. The packs themselves are then updated on a quarterly basis to ensure that the information is useful and that we're encouraging local places and carers board to take ownership of the contents of the pack and then publish them and make them available locally. My ambition is a pack in every place across the North Eastern Yorkshire region. And to date, we have a pack in 4 of the places in West Yorkshire, each place in South Yorkshire, and pack development work is currently happening in South Tees, Northumberland and North Lincolnshire. And Edward, I don't know if you're on the call, but York starts tomorrow. But the first place to start the work was in North Tyneside. And I'd now like to use the North Tyneside pack as an example of what the pack looks like. So the work in North Tyneside started as a result of support to primary care teams with regards what's called a carer-friendly practice award scheme. And the award scheme is a local commissioning arrangement, which means that there's a commissioning process with regards work to implement the quality markers with regards unpaid care for carers. The initial sort of feedback in North Tyneside was that doing this work was too much, even when it was when there was a commissioning sort of cycle in play. And then what we've done then to make it much easier for primary care is develop the pack itself, and that's kind of really how the work started. You'll see this is the top slide. The packs themselves are a series of PowerPoint slides. And you'll see that one of the interesting things on this sort of top slide is that the NHS England logo is not on the slide. That's really important for me because my role from a regional perspective is to come in and act as a kind of outside influence, if you like, to be able to listen to a range of voices. And then my job is to write the information onto the pack and then make that available locally. But the packs are very much owned at place. So that's why you see the North East and North Cumbria badge top right. The big purple key is the branding of the local care centre in North Tyneside, Clare Easton service. And again, it's really important that those two brands are reflected right at the front. What this says is that this is a joint piece of work. This is the teams coming together across North Tyneside to really set out what the offer is to carers. The packs, the kind of what we call the expanded versions of the packs can be up to 30, 40 slides long. So the way that we address that issue is that there's two versions of the packs. In South Yorkshire, we call them the concise and the extended version. And what I'm going to do today is just show you the concise version. But acknowledging the fact that a huge amount of information is a risk, this slide is intentional. And what it says is if you get nothing from these slides, please take these messages home. So I won't go through them too much, but the first one is, please ask the question, do you provide support? With consent, please make that referral for the carer through to the North Tyneside Care Centre. Please make the carer aware of any local personalised care services, such as social prescribing, and make them aware of the free digital support offer from Carers UK. Again, that has just recently been commissioned across England. So again, these are just the kind of headline offers that we want to make to get across. The other big one that we're trying to do is trying to get a human being in a system to take ownership of the carers agenda. These people are called different things across the region. In North Tyneside, they're called carer champions. In South Tees, where we're developing this work at the moment, they're called carer ambassadors. This slide is I'm just going to cough. This slide is the beating heart and soul of the work, though. And my vision is that across the region, these slides will be printed out, maybe laminated, bit of blue tack in the back, and then stuck up behind the computer screens in any system kind of reception offices. And the idea of this is that it's got the phone numbers, it's got the practical information that, for example, a receptionist might need, or a nurse associate, or a district nurse, or a social worker for that matter, to be really quickly able to give the information to that carer. So you'll see on the second column, the phone numbers there, 0191 643 2298. It's a universal offer in North Tyneside, so any carer should contact that number to speak to an expert about their condition. And what the North Tyneside carers team can do is then signpost that person on or make them aware of the service that they provide. The next number down is the local personalised care service, the 191. That number is how a carer can refer themselves into social prescribing offer. Forgive me, national team, if that's the wrong code. But again, what we're keen on doing is making sure that carers are aware of their local code so they can access the digital resource offer. That code is actually becoming more and more important following some feedback that we've done. One of the things that we found in North Tyneside is that carers an awful lot of time said, don't refer me, I don't need that information, I'm really busy at the moment, I'm doing my caring role. And one of the things we're finding is that that Carers UK offer is really good because people can access it in their own time, and they can then, that can be a way in, if you like, of trying to get somebody who maybe doesn't identify as a carer to be able to signpost them through to the best offer. There's then a slide about referring on. Giving a post-it note to somebody isn't the best way to refer anybody to anything. So what this slide does is just give a bit more information to that staff member, a bit more formal ways in which they can be referred on. And then we talk about the purpose of the pack. You'll see that the pack itself is taken from the quality markers for unpaid carers, and it's also got the NICE guidelines, the the QS200 and NG150 sort of guides from NICE. So again, this just kind of shows that we didn't make it up, that there's very much a lot of strategy and thinking that's gone into development of the pack. And finally, for the pack, just to give you an idea of what's in the rest of the slides, lots of information for sites about the benefits of supporting carers, how to create a carer-friendly culture. Young carers get their own set of slides. So the top tips, for example, are in there. Coding carers, I could talk for hours about that. Annual wellbeing checks. And again, and the final one is carers in the workforce. That receptionist, that nurse associate, that social worker who is also a carer, what support are they receiving from their local system? The next thing I'd like to do is show you my final video. And again, this is the video, another video that was developed in West Yorkshire. And this one was actually developed with regards to the quality markers that I mentioned. And again, I think this gives a good flavour of what it feels like to be a carer, and also gives an idea of some of the actions that we can be taking to improve the experience of unpaid carers. Again, links on the webpage to the quality markers themselves. I really like the quality markers. I set up practical ideas for sites to co-produce ideas to improve the experience of unpaid carers. And again, the quality markers were really key in the development of the carers resource packs. Now, I'm only going to talk for 2 or 3 more minutes, Steve, you'll be pleased to hear. I just want to give you some really quick feedback that we've had with regards to PAC, and then to talk about the ambitions, and then I'll stop and we can, I think there's some, so if anybody's got any questions that they'd like to ask, if they want to put them in the chat box, or we can do that. So the feedback. So it's early days for the PACs. There have been some amazing kind of results in North Tyneside, but I don't really want to go into too much detail about that because there is a local commissioning service in play there. So instead, what I'd like to do is focus on some of the feedback that we've had from South Yorkshire, where the PACs are all in place at the moment. We did a survey after the first version of the PACs went out, and the feedback was unanimous that people found the PACs to be really useful and they would recommend them to colleagues. And these were just some of the things that people said, that PACs kickstarted an amazing project. A lot of people didn't know about any of the support available, and everyone has been very grateful for the resource. And in all honesty, that's the sort of thing that we're looking for at the moment. What we're trying to do is just get some evidence together that this is a useful project. What I'm really interested in doing is looking to see how these PACs are then owned locally, because sustainability has always been one of the big risks in this project. And we don't want this project to be one that comes and goes. That Scottish guy at the region came and wrote some stuff and then it all disappears. So now what my main focus at the moment is very much looking to ensure the PACs are owned locally. And a great example of that work is work we're doing in North Lincolnshire at the moment, where carers, we've done an initial draft version of the PAC, and then my colleague in the local authority, Teresa, I don't know if you hear Teresa, has really gone back to carers with that, and then it's being adapted and changed again. And that makes me really happy, because the more local ownership a PAC has, the more likely it is that it will be adopted, and the more likely it is that it will be sustained. So my final slide is just to talk a little bit about next steps. So as I say, I'm really keen to look at local ownership of the PACs to ensure that they are embedded and used. And from a kind of NHS England perspective, we're really keen to look at continued use and the accumulation of the evidence of how useful they are. In South Yorkshire, we've recently had the PACs published on the ICS website, making it much easier for teams to access the information. So again, that will kick off a next set of projects for getting the information out there. And the ambitions from the work from a regional perspective are to support the integrated care boards to realise their ambitions for carers as set out in their strategies, to support a collaborative approach within and amongst the ICBs. They're better working together for carers. As I say, a PAC at every place. And the last thing I want to just sort of finish on this sentence, I really want to highlight the partnership approach that working for unpaid carers demands, and using that partnership approach as an example of best practice. I think that one of the lessons that we've learned from this work is that we cannot do this alone, that it has to be the system coming together. So it's not just the system-led approach, but it's the system working together to take actions to improve the experience of unpaid carers. And that's the end of my presentation. Thank you.
Fantastic. Thanks, Campbell. Apologies, I'm having network issues, so my system is just pausing for a bit. Okay, there we go.
It's really interesting seeing like some of the similarities of what we're trying to achieve in our services, and then some of the new sort of I'm just looking at the Carers UK like digital resource that looks really interesting. Is that something that's free when you kind of work in partnership with Carers UK, that you offer that with your local services. Was that an easy was that easy to do? I don't know whether you could tell us a little bit about that.
Yeah, I can take that. The National Commitment to Carers team, I don't know if Verity or anybody's on that would want to chip in if I get this wrong, but Carers UK provide a digital resource for carers, and what the national team have done is secured a license so that pretty much everybody in an integrated care board, any carer can access that resource using a code. What I'll do, Steve, is there's some great comms that recently went out on the ICS newsletter, and it's got 2 links on it that has all the information about it. And Hannah, what I'll do is before we send the slides out, I'll put all of that information onto the slides so it's available. But yeah, as I say, a really great resource, especially for those carers that don't feel that they want to make too much contact too early or don't have time, and it's a good resource.
Thank you.
I think that's the biggest question regarding the resources that are being shared. So to everybody, we will be sharing any links to resources or the presenter slides and the recording as well after the session. So please don't worry, if you've registered, we will send them after the session. Do we have any more questions or anything in the chat box that people have put in? I can't see anything in the combo.
So no, that's interesting. Yeah, because of course this is part of the Hope kind of experience of care, so they will all be on that futures on the Hope Future site as well. I'll put my email address in the chat box. If anybody's got any specific questions, then please give me a shout. I think one of the things I should probably say is that this PAC approach is just one of the many things that we've been doing up here. And it is very, the way in which I have kind of instigated this work at places is very local to our region. It just seems to be one of the ways in which this work works. But what I'd recommend that people do is also make contact with their local regional leads, because there's a huge amount of work going on out there at region with regards to carers work. I don't know if Jodie or Charlotte, Debs, I don't know if you want to put your camera on and wave, but if you've got, there you go, that's Debs from London and Jodie's from the east of England, Charlotte's from, I can't remember if it's southwest, southeast, and Caroline and Sigrid. But again, there is local contact available for you should you have questions with regards to the actions that are happening at place. And I recommend talking to a regional lead, because one of the things that we do really well is be able to look at a very complex system and then have a great understanding of how it all connects. So if in doubt, contact your regional lead.
I'll just putting our email address as well in the chat box to say if you need contact details for your regional leads, please just drop us an email. Or Debbie, I can see online. You can drop your email in the chat box. Then people can see. Just put your name, your email address, and the region that you represent. That will be very helpful to people. Thank you.
Just have a look at the chat box. Yeah, Sarah's made a comment about the personalised care element of this work. And again, that's one of the key elements of this. I think one of the key messages would be, don't make assumptions. It's very much about treating individuals as individuals.
We've just designed, well, sort of finalising almost like your carer pack, but like online e-learning for our staff. There's still like we use the pathway that you put in the discharge planning, like we use that, identify, you know, the 5 sort of areas, and they still find it so hard to identify carers. They just really struggle with that concept. And we don't know, you know, we're looking at like whether it's around capacity of staff as well as the culture around it, but they really struggle with identifying still. And then we just, you know, we're getting it wrong right at the beginning, and then the rest of it just kind of falls to the wayside. But that's what we're struggling with, and we're sort of doing this basic one kind of carers awareness, but also then what we're seeing is it's more like service level around contingency planning and associated people, and then even those details around the clinical side of things that they struggle with. Sorry, you're smiling. I don't know whether sort of
No,
blabbering on a bit, but
no, you're far from it. No, just really quickly, I wanted to apologise for completely missing out Rachel from my list of regional leads. Rachel, I owe you a coffee for that one. And Hannah, I completely agree with regards culture. However, I am a psychiatric nurse. I used to work on acute psychiatric wards, and I have been that nurse with 2 patients in accident and emergency. 3 patients that could probably go home, but their mum will look after them. I'm sure it'll be fine. And I was that nurse that didn't put any more exploration into thinking how that mum would cope with that discharge. It's the system, it just is. And one of the things that we are really keen on doing is going with this approach of, we want to make it easy for you to understand the issues. We want to make it easy for you to recognise the benefits of you looking after the carer. And I find that going with that approach as an offer rather than an ask has opened it. I've never come across a door yet where people say, we don't want the offer, Campbell. All that people come back to us and say is, this is the list of things that we have to do. How can we ensure carers are involved in that list rather than adding it as another thing to do? So that kind of open approach seems to work well and would be my recommendation. And that's, as I say, one of the philosophy behind the PAC approach. Make it easy.
Do you want to chip in, Debbie? Can see you nodding your head.
Thanks, Steve. Well, as someone who's worked in this space for, 20 odd years, I'm so impressed with all the incredible work that's gone on in the northeast of England. It really is brilliant. And actually, Campbell and colleagues, Hannah and others on this call, you really ought to be very proud of the impact. I would second what Campbell was just saying, is that sometimes we get bogged down in the detail. And actually, I've always found that the best way to land any of the carers' message is keep it simple. The identify, recognise, support. Those are 3 practical actions that everyone can do something for the carer in any health setting or in any other setting within the systems too. But I think you're onto something there, Campbell.
Thank you, Debs. Sean Cartwright, before you go, thank you for your Carers Leads, the survey that I mentioned, an excellent piece of work. And Steve, maybe we should leave it at that. The kind of key message, I think, Debs, has hit the nail on the head, is don't overcomplicate this. I think, Steve, from the national team's perspective, it really isn't rocket science. And I think that we can take some really simple actions that have a huge impact on people's lives.
I agree.
And save our systems lots of money.
Well,
if that won't motivate us, nothing will.
Oh, thank you, Campbell. Any more questions before we say our goodbyes? Or if you think of any other questions, please feel free to just drop Campbell an email. He's put his email address in the chat box. And as I mentioned at the beginning of the session, we will be sending out the slides and the recording at a later date. I think they will also be available on the, I think there is on the Hub Network platform on the Futures NHS space as well. So we have another, since it's Experience of Care Week, we have there's another session coming up tomorrow, which is person and family centered care. So please do join the presenters and give them a bit of support tomorrow as well. Thank you. Thank you, Campbell, and thanks everybody.